Hi, my name is Jennifer Courcelle, and today I'm going to talk to you about hypoglycemia. We have several objectives. One is how to recognize the signs and symptoms of hypoglycemia. Two, how to treat your patient who is having a hypoglycemic event, conscious and unconscious. Three, helpful hints to remember the facts about hypoglycemia. Four, demonstrate the use of glucagon. And five, followed by a scenario on how to treat your diabetic patient who has a hypoglycemic event. Hypoglycemia is defined as a drop in blood glucose levels below 70 milligrams per deciliter. According to the ADA, the normal blood glucose is 80 to 130 before meals. Acute hypoglycemia is considered to be a dangerous drop in blood glucose levels that fall between 45 and 50 milligrams per deciliter. Symptoms of hypoglycemia occur in different blood levels according to the individual's tolerances and how rapid the levels fall. Moderate hypoglycemia is 50 to 70 milligrams per deciliter. Why does hypoglycemia occur? This can happen from taking too much insulin, not eating enough food, not eating at the right times, or inconsistent amount of exercises. Hypoglycemia can also occur with gastroparesis, renal insufficiency, and with taking certain drugs as aspirin or beta-adrenergic blockers. What causes hypoglycemic symptoms and what are they? The rapid fall of glucose in the blood produces adrenergic symptoms in which the body releases hormones to recover normal glucose levels such as epinephrine for fight or flight, cortisol, the stress hormone, glucagon, and GH, growth hormone. However, when the blood glucose falls over several hours, it produces a neuroglycopenia. These symptoms affect the brain. In the case of adrenergic symptoms, there are tremors, shakiness, nervousness, irritability, tachycardia, anxiety, lightheadedness, hunger, tingling and numbness to the lips or tongue, and diaphoresis, excessive sweating. For nutroglycopenia, symptoms are drowsiness, irritability, impaired judgment, blurred vision, slurred speech, headaches, and mood swings, progressing to disorientation, seizures, and unconsciousness. What can be done to treat hypoglycemia? First, give the patient 15 grams of quick-acting carbohydrate. What are examples of quick-acting carbohydrates? Orange juice, hard candy, or high sugar soda. Repeat 10 to 30 minutes until the blood glucose is greater than 70 milligrams per deciliter for adults and 80 to 100 milligrams per deciliter for older adults and children. Remember, recheck the blood sugar. Be careful for rebound hypoglycemia. This can be done by giving an additional source of protein. This will sustain and regulate the blood glucose longer. A good source of protein would be an example of peanut butter in patients who are able to swallow and who are conscious. But if your patient is unable to swallow and unconscious, then give intramuscular or subcutaneous injection of 1 milligram of glucagon. Or you could give an IV dose of 50 milliliters of 50% dextrose as ordered or by protocol. The causes of hypoglycemia may be divided into three categories: exogenous, outside the body; endogenous, inside the body; and functional. Exogenous hypoglycemia is caused by outside factors acting on the body to produce the low blood glucose. They include the medication insulin, oral hypoglycemics, and alcohol or exercise. Endogenous hypoglycemia is caused by internal factors like excessive secretion of the hormone insulin or an increase in glucose metabolism. Functional hypoglycemia is caused by a variety of issues including gastric surgery, fasting, and malnutrition. There is also a medical diagnosis of hypoglycemia. This is not associated with diabetes. It can be diagnosed based on a fasting blood glucose, or an oral glucose tolerance test, an IV glucose tolerance test, or a 72-hour inpatient fasting. This diagnosis is identified as Whipple's triad. The presence of symptoms of hypoglycemia, documentation of low glucose when the symptoms occur, and the improvement of symptoms when the glucose rises. Medical treatment of hypoglycemia. When caring for an unconscious patient who has diabetes, hypoglycemia should be suspected until it is ruled out. As previously stated, 50 milliliters of 50% dextrose solution, otherwise known as D50, intravenously should be administered immediately. The patient with a milder form of hypoglycemia and conscious should be treated with 15 grams of carbohydrate. If the condition does not improve, another 15 grams of carbohydrate should be repeated in 10 to 30 minutes. Here's some important assessment tips for a hypoglycemic patient. You know the patient's going to present with tremors, shakiness, nervousness, irritability, tachycardia, anxiety, lightheadedness, hunger, tingling or numbness of the lips or tongue, nightmares, or crying out during sleep. It is important to note when episodes occur in relation to meals, and particularly the food that they take. The medical history may reveal diabetes, adrenal insufficiency, or abdominal cancer. Medications. Pay particular attention to hypoglycemic agents, noting the prescribed dose, the time the last dose was taken. Functional assessment. Information about current diet, exercise, alcohol intake, and the effects and symptoms of daily activities. Document important aspects of the physical exam, including general behavior, appearance, pulse, and blood pressure. We've talked about simple carbohydrates. These are some easy tips and easy mnemonics to help you remember how to treat and to recognize the patient with hypoglycemia. These are glucotabs. Glucotabs can be easily carried and handy in case of hypoglycemia. The sugary soda, and of course, the hard candy. Starting with the mnemonics. A mnemonic is a simple phrase or a series of letters to help you remember things. First we'll say, cold and clammy, give them some candy. Cold and clammy, give them some candy. So cold and clammy, give them some candy. Hopefully this can help you recognize the diabetic and what to do. Next, we have an additional mnemonic. And this spells out tired. T-I-R-E-D. T. Tremors and tachycardia. I. Irritability. R. Restless. Or restlessness. E. Excessive hunger. And D stands for diaphoresis excessive sweating, disorientation, or depression. Now we have T, tremors and tachycardia, fast heart rate. I, irritability. R, restlessness. E, excessive hunger. D, diaphoresis, disorientation, and depression. Tired. Hopefully this can help you in your next adventure with nursing and hypoglycemia to remember these symptoms. There are multiple resources out there that can assist you in taking care of your diabetic patient or your patient who has hypoglycemia. One of the important technology advances are apps. And I have an app from Eli Lilly that will demonstrate a simulator of glucagon and how to administer that to your patients. So let's get started. This is the Glucagon app. It can be really helpful for your patients to manage hypoglycemia at home. And let's begin the tutorial.
Step 1. Flip off the seal from the vial. Step 1. Flip off the seal from the vial of glucagon powder. Step 2. Remove the needle cover from the syringe. Do not remove the plastic clip from the syringe, as this may allow the push rod to come out of the syringe. Step 3. Insert the needle into the rubber stopper on the vial. Then inject the entire contents of the syringe into the vial of glucagon powder. Step 4. Remove the syringe from the vial, then gently swirl the vial until the liquid becomes clear. Glucagon should not be used unless the solution is clear and of a water-like consistency. Step 5. Insert the same syringe into the vial and slowly withdraw all of the liquid. In children weighing less than 44 pounds, withdraw half the liquid, 0.5 mark on the syringe. Step 6. Cleanse site on buttock, arm, or thigh and inject glucagon immediately after mixing, and then withdraw the needle. Apply light pressure against the injection site. Step 7. Turn the person on his or her side. When an unconscious person awakens, he or she may vomit. Step 7 continued. Call 911 immediately after administering glucagon. If the person does not awaken within 15 minutes, you may administer a second dose of glucagon if previously instructed by your healthcare provider to do so. As soon as the person is awake and able to swallow, give him or her a fast-acting source of sugar, such as fruit juice, followed by a snack or meal containing both protein and carbohydrates, such as cheese and crackers or a peanut butter sandwich. Step 8. Discard any unused reconstituted glucagon. Remember to notify your healthcare provider that an episode of severe hypoglycemia has occurred.
This is a scenario. You're faced with a patient who arrives. She's a type 1 diabetic. She's got tremors. She's shaking. She can't think. And she's very sweaty. She's on insulin. Probably hypoglycemia. First things first, check the blood sugar. The blood sugar is 50. Definitely hypoglycemia. First things, we'll give her a simple carbohydrate, 15 grams, some hard candy. We'll see how she feels. You doing okay? Yes. 10 to 30 minutes elapse. We check the blood sugar again. We wait and see. It's not 50, but it's not 70. So what do? We give her another simple carbohydrate. This time, let's try orange juice. Starting to feel better? Good. Give it a little bit more time. Try 10 more minutes and see what happens. Check that blood sugar again. Perfect. We're now in range, 75 milligrams per deciliter. She's fine. Maybe she'd like some peanut butter.